In this video we're going to discuss how to add and edit treatment. Wherever you see this tooth button, either in search list, or from check-in list, appointment list, lab work list, follow-up list, or from the patient's profile page, when you click over the tooth button, it will direct you to that patient's treatment page, which is the priority workplace for doctors. Here, in the treatment page, you can see some basic details of the patient, which is from profile page. Here, you can see the overall balance, which we will discuss later. Below comes the interactive dental chart, which shows the clear representation of patient's oral status. And below the chart, you will find the patient's medical alerts, displayed from the profile page, for quick reference. On the right side tabs, you can see the list of treatments, according to their status. First comes, In Progress tab color-coded in orange. Here, you can see the treatments, which are going on at present with multiple visits, like prosthetics, fixed or removable appliances, multi-visit root canals, etc. Next, the planned treatments, color-coded in green, which are proposed to do in the future. Then comes, the completed things, color-coded in blue, were previously done by you, or currently completed in your clinic. Then, the existing tab, color-coded in red, where you can find the treatments done outside, in some other clinic. Then the referred tab, color-coded in purple, where these things are referred by our clinic, to other specialists. Next, in the All tab, you can see all entries together, with also the observations, like missing teeth, root-only teeth, and cancelled treatments. At last we have, Overview tab. Ideally, before you start entering the treatments, you can mark the observations first. Here, we assume that all the first molars are missing for this patient. To select a teeth, click over the root area of that tooth to avoid selection error. Once you click over the teeth, you can see some chart options appearing below. You can see the observations at last, where you have two options. Select all the teeth that you want to mark missing. Here you can see the selected teeth numbers. Now, click Missing. This will make the selected teeth to disappear from the chart. Next, I mark 2-5 as root stumps. I select 2-5, click Root Only, that's it. These entries will be listed in All tab, here. If you want to undo the change, just click Delete button in the list, which will make the chart back to normal. Let us plan a root canal treatment for tooth number 27. Select the teeth, click Planned. You will get this window, where you have three tabs. First, in the Treatment tab, you can see the selected teeth number, with selected status, Planned. Then, you select the treatment from these items, which is divided into some main categories, and have 3 levels. Take your own time to explore each category and their second and third levels. The second level denotes name of the treatment. The third level have some additional details specific to that treatment. You can select multiple options in this third level, and is also an editable field, where you can type here whatever you need. Next comes the payment details. The number of units will be shown according to the selected teeth. Next, you can enter the unit cost of the specific treatment. The estimate will be calculated automatically, depending on the units. I can add any discounts, any payments done, and the payment mode. If the balance is fully paid, then you can check this box, and the balance will be populated to the paid field, and show 0 balance. In the next line, you can see the net amount, total paid, and balance. Here you can add some payment notes if any. When the treatment is linked with a lab work, like prosthesis, appliances, etc., you can select the specific lab, and add some notes if any. This will be listed here in the dashboard page, Lab Works, where you can manage their status. Next comes the Procedure tab, which were discussed in detail in a separate video. The next tab is the Clinical Notes, where you can enter chief complaint, diagnosis, investigation, dental history, current medical conditions, complications, for that specific tooth, or for the specific treatment. The multi-level chipset allows you to enter the data rapidly, by just clicking over the details, what you need, and also add some notes if you need. Once you select the details, click on Add button, and go to the next item. Here, the treatment name is the only mandatory field to save this window. All other are optional. After entering required details, you can save this window. Click over the item to expand and see the details entered. Now, we will learn about some buttons in the treatment list. The letter P indicates the planned status of the treatment. Next comes the Add Procedure button, which we will discuss in Adding Procedure video. Next button is used to edit the treatment name, clinical notes, or add lab work to the treatment. Let us assume we have started this crown work. So I select a lab for this prosthesis, and save. You can check the lab details if you expand the treatment, and also listed in the dashboard Lab Works. Since we started this work, it's going to be an in-progress state. So in the next button, I update some cost and payment details, and change the status to in progress. Now, the treatment will be transferred to the In Progress tab, and the color changes to orange, also in the chart, representing the treatment. Now you can notice the overall due here, because of the in progress balance.